carrier. Your safety and the safety of others is in your hands.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
As a strong immune system increases the chances of victims surviving COVID-19, a corruption-free society creates opportunities for citizens to thrive and prosper. Build your immunity. Stop corruption now. Report all acts of corruption to ICPC on this toll-free number 0800 22 55 4272. This message is brought to you by ICPC and NTA.
Thanks for staying tuned. We want to have a discussion right now. We're being joined via Zoom on Bauchi State COVID-19 Molecular Lab, which was recently established by the NCDC. Joining us is Dr. Rilwan Mohammed. Thank you very much for joining us, Dr. Mohammed.
Thank you very much. You're welcome.
All right. Can you bring us up to speed on the recently established NCDC Molecular Lab that was established in the state?
Thank you very much. Because of the exigencies of taking samples to Abuja or to reference laboratory in Bom, where the executive governor of Bauchi State, Senator Bala Mohammed, decided that we need a lab in Bauchi State, which is a molecular reference laboratory. So we contacted NCDC and asked whether we can be able to do it, and they gave us a go-ahead and the procedure how to get a new lab, which we did. Within 3 weeks of the commencement, we work on this molecular laboratory, and then with the support of the Northeast Development Commission, which supplied all the needed tools, particularly the PCR machines, the activation machine, and other machines that are needed in that. With the new ambulance was done by the Northeast Development Commission. And the Nigerian Center for Disease Control are actually our support in the area of technical support, and even some of the chemicals that are used in the laboratory are supplied by the Nigerian Center for Disease Control, and they give us a lot of technical support. The governor is yet to commission that laboratory, but activity has been started. They gave us a lab number 29 as our activation number, and our people have been trained and work has commenced. Even yesterday, we got 25 total number of confirmed cases from the lab.
Okay, Dr. Mohammed, you talked about training and more of the capacity in the state, but what's the secret behind the very low death rate from coronavirus in the state?
No, one of the things that we are doing differently from other states is because any patients that are on admission in Bauchi State, we start treatment immediately. We don't wait for symptoms to appear. Secondly, all the patients on admission, His Excellency the Executive Governor said that we should feed them very well, because he noticed when he was on admission as the intest case of the state, Senator Bala Mohammed said we should feed them very well, 1,500 naira per patient per meal. In the morning, 1,500. In the afternoon, 1,500. At night, 1,500 with bottled water. So that this will fight the immunity with our food. And that is the reason why all the people that died, except yesterday, we have one death, which is around 55 years. All of them are 60 and above. Those who have comorbidity. And we have about 8 deaths. As of yesterday, we have 9, which is a young man, at least 55. No female, no young person have died in Bauchi, except this one of yesterday. And the second one that we are doing is our chairman of the task force, who is Senator Babatela, is also very active, and the commitment of healthcare workers, the case management team, all the surveillance team, anywhere we had a rumor or an alert that this person is having signs and symptoms or is returning from other places, we quickly rush to that area and either carry out case investigation to see if he can be tested or monitor him with thermometer. The reason why we have low death rate is because we have committed staff and all our healthcare. Do you know we have 48 healthcare workers who are infected with the virus due to working in their own environment, but all of them were cured and they were discharged.
Well, Dr. Mohammed, you talked about the commitment of healthcare workers. Well, as the chairman of the State Primary Healthcare Development Agency, what sort of response is ongoing at the healthcare centers?
No, actually, all our staff at the general hospitals and the teaching hospitals, the private clinics, the pharmacy department, the laboratories, all were trained on COVID response. Secondly, we trained all our other paramedicals that are working on this with support of our WHO and other agencies. We train all of them. So that is the reason why Bauchi State has been a center for actually a case study for Nigeria today, because we all are patients. As of yesterday, we have more cases rising up, but all our cases were coming down. We did not do all total lockdown, but we did partial lockdown. But we are monitoring all people that comes in, particularly our returnees. Our community are buying into this aspect. They inform us of the coming of any person that's new into the community. Our traditional rulers are also helping. Our religious leaders are also helping in the area of seeing any new person coming to the mosque or church. They inform us immediately, and then they carry out social distancing in some places. But we have a problem, particularly the area of social distancing in the mosque and church. That is the area where we tell the government to suspend the lockdown in Bauchi State for 2 weeks.